Welcome to The Beat, your go-to where leaders, founders, and investors share insights on growth, innovation, and business building. I'm Chitra Nabat, your host. Joining us today is Dr. Russ Richmond, Laudio's CEO and co-founder. Russ, welcome. Thank you for joining us.
Thanks so much for having me.
Russ, what is Laudio? How does it work?
Laudio is an enterprise SaaS platform for health systems, and it allows the frontline leaders or managers to create large-scale change through many human actions.
A lot of the companies at this conference and out there in health tech talk about doing the same thing, workflow automation, crowded space. So where's your sweet spot? How do you differentiate?
Really, the sweet spot for Laudio is the focus on the frontline leader or the manager. Our research has identified that they're the key fulcrum point to create change with the workforce, with the teams. So we've built an integration platform for them that pulls all the information to one place. We've built out the 8 major frontline leader workflows, and then we've automated the heck out of it using AI. That is a unique approach that no one else is taking.
So take one of those 8 that you talked about, one of those 8 examples. Give us an example, walk us through, and talk about the impact, whether it's time reduction, productivity, efficiency, cost, and ultimately health outcome.
Right. Laudio's impact across employee retention and engagement, as well as on margin improvement. One example of that is we might nudge the frontline leader to reach out to a nurse who has been the only experienced nurse working on 7 straight shifts. We know that is a burnout indicator. We know that will lead to that individual leaving. We connect the leader with the nurse on their team and help them with adopting a new schedule to reduce the burden on that individual worker. That's just one of thousands of actions that Laudio would enable, and each of those actions adds up to create the impact, like 20% reductions in turnover, or 46% reductions. We're publishing a case study with the University of Nebraska today on first-year turnover of nurses. So the impacts are very real.
How do you stand out? Because it's a very crowded market and there's a lot of stakeholders that you're trying to woo here. The doctors, the nurses, clinicians, the administrators. So talk about how do you stand out?
The executives in health systems are looking for a new approach to this topic. Workforce burnout and issues with engagement has been long-seated problems that got worse with the pandemic. There are not really great existing solutions to. So when they see a new approach that starts out with surrounding the leader with an integration platform that they can use, that they'll want to use, that's already fresh. What we found is that a lot of these frontline leaders have solutions pushed to them, that bought for them, that they don't want to use, that they won't use. And the unique thing about Laudio is the frontline leaders love us because we save them time. We save them up to 6 hours a week by automating their work and their workflow. And so out of the gate, this is embraced by the frontline leaders, not rejected by it. And that is generally enough to spark something that really increases and scales the usage of Laudio across individual hospitals and then across the health system.
You use the word spark. So how do you spark then that stakeholder, customer, acquisition, retention, engagement? Because ultimately it's about engagement translating to revenue and that revenue being sticky.
You know, it is tricky. It's a great question. The way we do it is using something we call evidence-based leadership. We're the first organization, at least that I know of, that has put hard numbers and science around what it means to be a great manager and a great leader in healthcare. And we publish that in the form of what we call Laudio Insights on our website. So every week we come out with a new insight that's evidence-based leadership from the data in our platform that leaders all over the country can use to improve. And those insights travel. The executives at health systems send them around and swap them, and the word of Laudio gets out through that mechanism. And then we get more and more inquiries through our website where we can demonstrate the platform, and that becomes some of the flywheel that helps us get into more health systems.
So talking about that flywheel, how do you, selling into health systems and these large organizations, it's a very slow process, right? It's like a turtle pace at times. Yeah. And so how do you get to market adoption at scale? And where does that flywheel how is that a lever in getting to market adoption at scale?
What we found, well, first of all, it does take time to sell to health systems. I've been doing it my entire career. They have long sales cycles, and for a reason, there's very real risks like cyber risk that they need to account for. But what we do is we make it a team-based sport. We love to pull together executives like the CHRO and the CNO in a health system and get them working around the Laudio solution. And that's the type of partnership where the CHRO feels like they can have operational impact with the CNO, where the CNO feels like they can do something that's very real and workforce oriented with the CHRO that really starts to get that flywheel turning. So we're putting executives together in our process, and then we've got great case examples from our current customers. We're in 25 health systems right now, and the evidence that comes out from the use of Laudio really wins the day. We're publishing those new case studies at a rate of about one per month. And one just came out today, I mentioned earlier, from the University of Nebraska, that demonstrated that we can reduce first-year employee turnover by 47%, which is huge. And it's those types of things that get the word out.
You mentioned artificial intelligence. Talk about where you're using AI at scale and where you're innovating next.
So what we're doing right now is we're using AI to sort the signal from the noise. You've got to remember, these frontline leaders are surrounded by systems, data, BI, dashboards, but what do they do with that information on a daily basis? It's almost too much for them. It makes their brain explode. So we're able to prioritize and nudge them with the most important actions that they can take on a daily basis with their teams, day in and day out. And we use AI to supply that. We're right now working on the next horizon of that and where we can automate more and more of the work away. There's so much work in healthcare that I would call just frankly brain damaging. It's administrivia, it's looking from system and copying here, and we can do something like automate the annual performance review with the data in our system, and we're starting to do work on that as well. That will save hours and hours and hours of frontline manager time that they will never have to do again. So that's the next horizon for us.
Russ, leadership. In life, business, there are rules, codes, norms to how things are done. Where have you been a code breaker and how did you do it?
That's a great question. I've never followed where the highest paying jobs are. I've always gone with what has interested me most intellectually, and that has often turned into doing well by doing good. I'm very passionate about the frontline caregivers. I myself was in the hospital for 3 months and spent 3 months with frontline caregivers that changed my life. And following that passion and spending time in that area has been the difference maker for me. And so my recommendation to everyone is, building these companies, it's a 10-year venture. Make sure you land on somewhere that you're really passionate about, that will speak here as well as up here.
Russ, thank you so much for joining us.
Well, I'm delighted to be here. Thanks for having us.